Boond Soch, Train of Thoughts, with a series of an episode with Dr. Sanket Mehta, who is a very well-known name in the country in the field of Cytoreductive and HIPEC surgery, and also is the president of the Society of Peritoneal Surface Surgical Oncology of India and director of SSO, the Specialty Surgical Oncology. So welcome once again to this show.
Thank you so much.
So in this episode, we'll be talking more in terms of as for the liver, which is concerned. Now, for the common man understanding what exactly is the liver cancer, are all the liver tumor cancerous?
So when we talk about liver cancers, we should understand that they can be either primary tumors of the liver or of the biliary tract. Biliary tract is the collecting system which collects the bile from the liver and delivers it to the GI tract. Mm-hmm. And so primary tumor of the liver is something called as a hepatocellular carcinoma. You of course have certain infantile tumors, but the commonest one is hepatocellular carcinoma. Mm-hmm. Primary tumors of the biliary tract are something called as cholangiocarcinomas, mm-hmm. which also involve the liver because the biliary tract is arising from the liver and then mm-hmm. goes down. It can be divided into intrahepatic, which is the biliary tumors within the liver, or extrahepatic biliary tract, mm-hmm. which are biliary tumors outside the liver but still affects the liver because they are linked to the liver. Mm-hmm. You also have tumors from other organs, in particular colon cancer, which mm-hmm. is very commonly spreads to the liver and which is very eminently treatable, even though technically it is considered as stage 4 mm-hmm. because it is spread outside the organ of origin. Mm-hmm. But colorectal cancer spread to the liver can be treated and treated well with excellent outcomes. So other GI organs also spread to the liver, but the results are slightly less promising compared to these three types of tumors.
Is it a myth that always liver cancer is associated with an alcohol?
Yes, it is a myth. While alcohol is definitely a predisposing factor where alcohol causes cirrhosis and then the cirrhotic liver develops a cancer, mm-hmm. it is not the only cause. In fact, even in India, hepatitis causes more liver tumors than does alcohol. So we do have several causes of liver cancer. Mm-hmm. There is also now this rising epidemic of non-alcoholic fatty liver disease mm-hmm. because of sedentary lifestyle, obesity, and high sugar intake and processed foods, mm-hmm. which is going to lead to an epidemic of liver cancers in India. Mm-hmm. And these are all modifiable risk factors.
Nice. And doctor, for the benefit of an audience, can you throw some light in terms of an CT and MRI, this thing, scan, which is, what is the difference like?
Yeah, so often when patient comes to our office, when we write down several investigations, they feel that by several different types of screening modalities, and that is because both CT and MR, while they give very useful information of the liver, they do not give the complete picture. CT scan is very good in identifying the different areas of the liver, the vascular supply of the liver, the biliary drainage of the liver, and the location of the tumor. But the condition of the liver itself and condition of the extrahepatic biliary tree is better evaluated on the MRI. Mm-hmm. Now, apart from that, we also sometimes do a PET scan to mm-hmm. see what is the aggressiveness of the tumor and whether it is spread outside the liver to other organs. Mm-hmm. So there are 3 different scanning modalities and we use them based on the clinical context.
Okay, thank you, doctor. Thanks, doctor, very much, and creating an awareness as well as liver cancer which are concerned. I'm sure the target audience who are listening to you will take some precautionary measure, and if there is any symptoms which are there, probably the test which you have suggested, I'm sure it's will be helpful for them to ensure they get rid of this kind of cancer. Thank you very much for being part of this show. God bless you.
Thank you.